So right off the bat, CBD is a vasorelaxant. So it helps to relax those arterial walls. So if we could imagine they're tight and they're constricted, CBD has the ability, as of right now, to relax those arterial walls. So that's one thing. Now, why is that important? That's going to help more blood flow to the area, right? Because cardiovascular disease, lack of blood flow, more blood flow. CBD, this was according to that government patent, it's a very strong antioxidant. Again, going back to our discussion on inflammation, as we know, there's oxidation, that cellular rust that we talked about occurring in our arteries. They're rusting away from all this plaque buildup. So CBD is an antioxidant. Think of an antioxidant as something that helps to fight that cellular rust. So from that standpoint, it's very promising. The other thing that they've been studying a lot is CBD's effects on blood pressure. Now, this one's pretty fascinating. I believe I've personally benefited from this using CBD. I can tell you, prior to using CBD and making some other healthy lifestyle changes, my blood pressure was always high. It runs in my family. It's a genetic thing. My father actually had 5 bypasses before the age of 40. Every male in my family has had a major heart surgery before the age of 40. So this is an important one to me. So when it comes to managing blood pressure, one of the things that they're really studying is stress and the connection between CBD being an anti-anxiety and anti-stress based supplement and stress's effects on hypertension, right? If someone's stressed, they're more likely to have elevated blood pressure. You'd hear that common phrase, someone's upset, and they say, oh, my blood pressure's through the roof, right? So what they're starting to find is that because of CBD's effects on stress and its positive effects on anxiety, that it may be indirectly lowering blood pressure via that route as an anti-anxiety, anti-stress style supplement, as compared to having a direct effect on the arterial walls themselves. Now, this one I think is super exciting. This was one of the reasons I spoke to my father about CBD oil when we really wanted him to start using it. The other thing that they're finding in mice is that after there's an infarct, so after there's no more blood going to an area, specifically your heart, there's tissue damage, right? Our muscles, our heart being a muscle, need blood to grow, to heal. If you don't have blood supply to the area, that tissue actually dies. This is called necrosis. If you know anyone who suffered a heart attack or had a bypass, one of the indicators for how long they're going to live after that, they'll always say how much damage was done to your heart, how much of that tissue died. What they're starting to find in animal models is that CBD may play a significant role in starting to heal those dead tissues and actually bring them back to life to an extent. Now, even more exciting for someone like me who's trying to avoid having a heart attack, they're studying perhaps CBD from a standpoint of prevention, right? So is someone who's at risk of a heart attack and at risk of tissue damage going to benefit from using CBD oil? You always want to work with your physician. And the reason being is CBD is metabolized in the liver. This is something I get asked about a lot. Does it interact with other medications? Yes, there's 60% of the medications on the market are metabolized in your liver. So is grapefruit if you eat grapefruit, okay? So what happens when you take CBD with those medications? CBD may increase the amount of medication present in your blood or decrease the amount of medication present in your blood. For most people, this really only pertains to medications that you're regularly tested for. Blood thinners are one of those medications. Chemotherapy drugs are one of those medications. This is an easy thing to get checked though. All you have to do is speak to your physician and say, listen, am I concerned about one of these medications building up in my blood? Am I concerned about any of these medications interacting with grapefruit? If the answer is yes, through some simple blood work, they should be able to monitor it. Now, as a disclaimer, I'll say at any dose, if you feel you're at risk, you should speak to your physician. Generally speaking, if we're seeing below 250, 300 milligrams a day, and we've even seen studies go much higher than that, the likelihood of it interacting seems minimal right now. Now, with that said, CBD is very individualized, so I don't know how you're going to metabolize a medication versus how I'm going to metabolize it. This is why one person takes perhaps a painkiller and they feel fine and another person gets knocked out for days. We can't say for sure how that person's reacting to that medication. So that's just one of the things I like to mention when it comes to cardiovascular disease and using CBD oil. It is best to ask. It's usually some simple blood work, but in the big picture, it's probably only a few medications. Those blood thinners would be a big one, and the chemotherapy medications would be another one. What I would recommend is this, starting at a very low dosage, like we always say. And the reason being is, let's say you do have hypertension and you're currently being medicated for high blood pressure. Now, maybe at 10 milligrams of CBD, blood pressure doesn't change. Perhaps you hit 20 to 30 milligrams a day and your blood pressure does start to go down a bit. Well, you may need to adjust with your physician those medications appropriately. So why would this be bad? Let's say someone goes right off the bat with 200, 150, 300 milligrams of CBD a day. We don't want someone passing out because of a dramatic decrease in blood pressure. I've never seen that happen, even at higher dosages, but that's why we always caution start slow when it comes to cardiovascular health. The blood pressure is probably the biggest reason. Now, the other reason too, and people don't usually consider this, so going back to hypertension, high blood pressure, let's say it is related to an anxiety disorder or a stress disorder. Someone may find that at the right dosage, that anxiety feels great. And it might be a very small dose. We have people who take 30 milligrams a day, even 5 milligrams a day, and see good results. We have some people who have to take 200 milligrams a day. Now, why would it be an important case if we're trying to lower blood pressure in the presence of anxiety? Because we know if you take too much CBD, it has that biphasic effect. So at too low of a dose, it doesn't work. At too high of a dose, it may have the opposite effect. So in the case of anxiety, we wouldn't want someone to be more anxious because, one, they'd have more anxiety, and two, their blood pressure may go up. How do you avoid that? Start slow until you hit that sweet spot and then stay there. You can always increase. It takes a little bit more time to decrease. You'd rather avoid a reaction.